Shalom and welcome to 2 Minutes of Torah. This year is entitled Daf Yomi Yevamot 12b. Gemara introduces the concept of contraception from the Talmudic times. And it talks about certain women that were allowed to use a moch, some form of a contraceptive, because either there was a danger to the mother or to the unborn baby, or if she already had a baby and she was nursing, it could be a danger to that baby. So there's some kind of danger involved in every case. This is, of course, a very, very delicate topic. There's a few different sugyot involved. One is the hashchata zera. The tashmish hamishta always must be done in a way where there's not going to be hashchatat zera. And therefore, the moch, according to Rabbi Tam, would have to be done afterwards. Even if there's a danger, it has to be done in a way there's no hashchat of the zera. So it has to be normal tashmish. And any moch that would be used would be put in afterwards. That's Rabbi Tam's understanding of the issue here. So there's another, that's one aspect, is hashchat of the zera, and has to be derech tashmish, normal kinds of tashmish that would not be defined as hashchat of zera. Then the other issue, of course, is puravu. A man has a chiyuv of puravu midaraita, a boy and a girl midrabanan. The mitzvah is to continue as it kozman sheish bo koach. So any kind of contraceptive must always be brought. The shiloh must always be brought to a posek, because these two issues must always be discussed. The miniyat harayon, not becoming pregnant, could be a biblical violation of hashchat zera. And it could be a vatal v'yaseh, either the writer of a boy or having a boy and a girl, or if the couple already has a boy and a girl, then the Rabbanan mitzvah to continue. And it's important to stress this is like any other shayla halacha. Just like a couple is going to go and ask questions to the rabbi about tarat mishpacha, about the question of the onion that was cut with a dairy knife and put into a fleishik pan. And about Shabbos, when a woman forgets to light, does she have to light more candles the next Shabbos? So this is a person who's a halachic Jew is going to ask about this as well. And the person says, well, this is my business and my decision. Family planning is something that me and my husband, and we decide on our own. Well, if the person wants to say that, that's certainly not a halachic approach. A halachic approach is that all of Tayyag Mitzvot is subject to guidance by a halachic authority. Rav Moshe in this topic, maybe more than any other topic. He had dozens and dozens of tshuvas on this topic, and he always writes that whatever he answers to one couple is specifically to that one couple. There's always new factors that have to be discussed and that have to be analyzed, and the biblical mitzvah of puravu must be taken into account. The rabbinic mitzvah of puravu must be taken into account. The physical health of the couple, the mental health of the couple, financial status of the couple. These are all variables that must be addressed by the posek when he deals with these two issues, the hashchat zera and the puravu. Hashchat zera, of course, which we'll discuss further in the future, has to do with, of course, what kind of birth control. The easiest one would be a pill where it does not in any way interfere with the derech tashmish. So that might be one way to avoid hashchat zera. But on the other hand, of course, you still have to take into account the question of miniyat haron and the mitzvah saseh of puravu, the d'oraita drabanan. So this is just a little overview. And of course, any shayla must be directed to a posek. Shalom.